I have it in Spanish, but let me remember how we say it.
My name is Brett Neeson, and I work for the HIV STD program at Public Health Seattle King County. I was assigned to do a project for National Latino AIDS Awareness Day, and this was an idea I had to try and get the word out for that day.
Just a few weeks ago, I got a phone call from Brett at Public Health, and he said, hey, why don't we do this thing? And it was a little unexpected, and I thought, well, what a great idea. And so we very quickly put the word out in the community, and people got really excited about this opportunity to work together on a project that could have a lot of impact. And the fact that it's a video, it's going to go viral, all of that just generated a lot of excitement.
Let's just do one more, just for the hell of it.
Sure. I'm getting an education so I can give back.
And also sharing cultural values, the chance for people to talk about how they care for their community, how they look after their friends, how they look after their parents and their family. People don't really get a chance to represent that in something so public. That chance doesn't come along every day.
My friends know they can call me day or night.
Lovely. Now let's try that in Spanish. What I was really drawn to with Brett's concept for this piece was that it's coming from a place of emotion. That ultimately, most of us have most of the information we need to do the right thing in terms of taking care of ourselves, most of us, most of the time. But what we have are emotional barriers and blocks and fears and prejudices and whatnot that prevent us from accessing that information and applying it in a good way to take care of ourselves and each other. And so, for my money, I think it's absolutely important that the first thing you have to do is to engage the emotional connection that we have to each other and we have to why we're here on Earth. And getting that emotional information across that's universal and connective is exactly what allows people to apply the knowledge that HIV testing is a good thing.
We're trying to bring about the end of HIV stigma and stigma related to sexual orientation next to HIV. So we really wanted the commercial to incorporate people from all walks of life, all ages, all orientations, all genders, so that people knew, we are really all in this together, and it's something that we all have to care about and we all have to get tested, because that's what is going to allow us to find the disease early, and if we find it, get people on medication, and that's what we know keeps people the healthiest.
Part of our work is reaching out to the Latino LGBTQ community in terms of our health promotion and that sort of thing. And then it's also reaching out to the Latino heterosexual community and to build that bridge and to promote understanding and to do work that's about anti-homophobia and anti-stigma. And so this project has been another way that we've been able to bring people together who are primarily LGBT people, but also people from the heterosexual, from the Latino ally community, in a project that blends those voices together and puts people side by side. And I think that it really helps everybody to see that we're really one community. And in the fight against HIV, we really need to be united and work together to control and ultimately really to eradicate this epidemic.
I really like doing projects like this because I get to work directly with the community, and the Latino community is a community that I brush up against from time to time, but I'm not that familiar with. And so working within what's for me a mostly new community and finding things that are very familiar and affirming is a really awesome feeling. And by that I mean that the message of this piece is essentially that we do care about each other. We care about each other in so many different ways. And then when we put that on our sleeves and we open that up to the world, it becomes much more powerful. And that's exactly what we need for a healthier community. And so it's good.
I get tested for HIV regularmente. Ooh, I combine English and Spanish, sorry. Ooh, that was weird.
Perfect.
Okay.